Hi, I'm Dr. Rich Brown, CEO of Wellsys. Wellsys offers a turnkey package of training, support, and software, so primary care settings, hospitals, ACOs, and other managed care organizations can systematically identify, address, and engage in the population management of prevalent behavioral issues, which exert huge impacts relevant to prevention and chronic disease. We promise you better outcomes and better performance on quality metrics, reductions in costs, readmissions, in-hospital complications, and uncompensated care, and increased potential to thrive under value-based reimbursement programs. In this video, I'll give you a quick overview of the problem we address with behavioral screening and intervention, or BSI, what BSI is and the evidence for its effectiveness and cost savings, how Wellsys helps healthcare organizations implement BSI, how BSI can provide the framework and infrastructure to address other needs, and potential markets. I won't speak to all the information on each slide, so feel free to pause the video when you'd like to take in more details. The problem Wellsys addresses is common behavioral risks and disorders. Most general healthcare organizations have long regarded behavioral health as a side issue. Now it's clear that systematically identifying and addressing behavioral issues is essential to serving the triple aim of improved outcomes, patient experience, and cost control. Wellsys works at the interface of general and behavioral health care. The U.S. Preventive Services Task Force and many other authorities recommend that all adults receive screening and intervention for smoking, alcohol, and depression. These issues are quite prevalent. They contribute to many chronic diseases and injuries and cause more than 650,000 deaths per year. They generate nearly $200 billion in healthcare costs and lots of other workplace and societal costs. Total cost exceeds $600 billion per year. A large national study of dual-eligible patients shows that chronic diseases are frequently complicated by behavioral issues, which dramatically increase costs. The study focused on dual-eligible patients with 5 common chronic diseases. More than 2/3 had a diagnosed mental health disorder, alcohol or drug disorder, or both. Those with the behavioral disorders had many more hospitalizations and generated much higher costs. Among hospitalized patients, the prevalence of these issues is quite high, and these issues are associated with higher rates of admissions, readmissions, and complications for medical and surgical patients. The good news is that BSI can help. Here's what BSI entails. We screen all patients for smoking, unhealthy drinking, and depression with 4 quick questions. For patients who screen positive, responses to further assessment questions indicate the severity of their risk or disorder. For smoking or unhealthy drinking, we use the empathic collaborative approach called motivational interviewing to help patients take stock of the pros and cons of change in light of what's important to them in their lives. We help patients strengthen their own arguments for change because stronger commitment to change results in more success. We offer feedback on health risks and consequences and recommendations to optimize health, including referrals as appropriate. We help patients committed to change design a personalized behavior change plan and refine that plan over time to meet their goals. We always respect patients' decisions on whether and how to change. Even if people don't change immediately, we often plant seeds of change for the future. For depression, we add collaborative care to medications and/or counseling. Collaborative care involves these basic coaching activities. It's also helpful if a psychiatrist can review medical records and advise others on diagnosis and treatment. Then we provide follow-up and ongoing support as needed. Ample research has shown that BSI is effective. BSI dramatically increases smoking quit rates. Cost savings are huge years later when many serious illnesses are prevented. For patients with current chronic diseases, cost savings occur in the first year. BSI reduces unhealthy drinking by 20%. That, in turn, reduces emergency room visits by 20% and hospital admissions by 37%, which yields cost savings of more than $500 per primary care patient in the first year. We see year-one cost savings of greater than $4,000 per patient for high utilizers. BSI results in higher depression remission rates, net cost savings within 1 year, and over $4,000 in net cost savings per patient over 4 years. You can find more details on the business case for BSI in this article. Currently, many patients are screened for smoking, drinking, and depression, but few receive the robust interventions and ongoing support necessary to optimize outcomes and reduce costs. That's a huge missed opportunity for patients and for healthcare organizations' bottom lines. The biggest barrier is that current clinicians and staff don't have time, and many lack training. That's why our implementation model, refined over 10 years of experience, involves expanding healthcare teams with specially trained and supported coaches. Here's how Wellsys helps healthcare organizations implement BSI. We guide them in selecting or hiring individuals with excellent potential as coaches. We train those individuals from scratch with intensive webinars and face-to-face practice and feedback. We continue to support them for up to a year with regular case conferences and reviews of audio tapes of sessions with patients. We develop them into true behavior change experts. We equip the coaches with tablet-based software which helps ensure high-quality service delivery, engages patients, prints out summaries, which some patients hang on their refrigerators, generates progress notes and billing information, tracks prevalence, service delivery, and outcomes, and enables complete population health management of behavioral issues. Evidence-based screens, assessments, and intervention protocols are built into the training and software. For clinical settings, we advise on workflow to maximize screening and warm handoffs to coaches for patients with positive screens. We also offer a telehealth platform enabling BSI delivery from central offices. Our software and telehealth platform exceed HIPAA and high-tech requirements. Once coaches have skills in motivational interviewing, behavior change plans, and collaborative care, they can easily branch out to other issues. Our software also supports screening, intervention, and referral for diet, exercise, and obesity. Coaches can also address other behavioral issues such as medication adherence and other aspects of treatment regimens for patients with hypertension, diabetes, and other common chronic diseases. They can screen and help with other mental health disorders, as recent research shows that collaborative care is effective for other conditions besides depression. Coaches can also streamline care for patients receiving pharmacotherapy for alcohol and opioid dependence, allowing clinicians to conduct time-efficient medication management visits like those for other chronic diseases. Thus, BSI and skilled coaches can serve as the infrastructure for behavioral screening and intervention, chronic disease management, and primary care behavioral health integration. Most patients with issues in one realm have issues in other realms, so it's best to have a single integrated solution rather than several fragmented solutions. BSI can help many healthcare organizations improve their outcomes and bottom lines. With BSI, ACOs would perform better on 16 quality metrics and generate lots more shared savings. BSI is also a great fit for various other kinds of managed care organizations, employer-sponsored clinics, and any entity at risk for healthcare costs. BSI can also help hospitals reduce readmissions, improve quality metric performance, reduce uncompensated care, and thrive under Medicare's Joint Replacement Bundled Payment Program and other bundled payment programs to come. As public and commercial players move toward value-based reimbursement, BSI and its offshoots will be a no-brainer for all primary care settings and hospitals. For implementing BSI, nobody can match the experience and turnkey program Wellsys can offer. I'd appreciate your support in helping Wellsys accelerate the spread of BSI. Thanks very much for listening.